to Rehab, now brought to you by Rehabilitation Institute of the Caribbean, providing medical care for function and performance in association with Winchester MRI, Jamaica's first choice for MR imaging. Immune Active Denk, a combination of key active ingredients designed to boost the body's natural defense. And Almighty Studios, a recording studio where we create worship music to praise, to worship, and to serve.
Hallelujah.
Today we have consultant physiatrist and rehabilitation medical doctor, Dr. Paula Dawson. Hey, Doc.
Hello, Alicia.
Yes. Yeah, man, that's fine. I'm your host, Alicia Taylor. Today we have a very, very special guest. I'm excited. She is another fabulous member of the fabulous Rehab Institute of the Caribbean team.
That's right.
Sade Thaxter.
Hi, listeners. Thank you for having me.
You're so welcome, Sade. Nice and cute. All right.
She is actually.
She really is. The foot is a foot.
Oh my.
This week as we discuss plantar fasciitis. I'm surprised I actually got that correct.
The foot is a foot this
The
week.
foot is a foot. So remember, you can check out our social media pages for more information on today's topic. We have Instagram, Rehab Institute Caribbean, Dr. Paula Dawson, Alicia Taylor Music, and on Facebook it's Rehabilitation Institute of the Caribbean. Our website, rehabcaribbean.com. Great. I have no idea what plantar fasciitis is. I don't know who's going to begin, but someone enlighten my collective darkness, please.
Well, I will start.
Go ahead, Doc.
And one of the reasons we have Sade here is because she's not only an awesome physical therapist, she's also a dancer.
Oh, look at you, Sade.
Yes, I am.
Yes.
I currently dance at NETC.
Yay!
So while I'm...
How much I big dancer, man? NTTC, we never start with that part. Hold on, let me introduce Sade. So we have Sade Thaxter, physiotherapist and dancer at the NDTC. Welcome, Sade.
For those who don't know, what does NDTC mean?
The National Dance Theatre Company.
That's right.
So you know, Fire. What's Fire name again? The head of Jesus. What's her name again? She used to play football for me at U. She was a forward. The head of she may kill me. Fire. Anyway, we'll remember her name later on. That was her whole name on Taylor Hall. Fire.
Really?
Yeah.
Just remember people calling them and can't remember them real names.
Kerry?
Yes!
Carrie and
I
Henry?
knew it was Kerry.
Kerry, my friend
Kerry
Kerry.
actually taught me.
I love you,
well.
Kerry. Kerry was an awesome forward.
She still play football?
Yeah, man. She
And
had Emily
Kerry
Shields.
dance?
She had Emily Crooks.
You can't remember Kerry, you know.
Me?
Yeah, man.
I'm not a footballer.
Yeah, but you know
Dancer.
you are a dancer, and so is Kerry.
Yeah.
God.
And you know some of my footballers used to have plantar fasciitis.
Because I was just gonna be like, we're so tangential right now.
No,
But
no,
you
no,
bring
we're not.
it right back to
I-
the
No,
plantar
man.
fasciitis.
University of the West Indies, you know, we used to play football. We used to have girls playing football.
Race car.
I used to play football for Jamaica. I told you that.
Yeah, I know, but man,
Yeah.
you had to play basketball with Michael last week.
I
It's
hurt
just
myself.
Unbelievable.
But listen, plantar fasciitis, guys, is... Alright, so the plantar fascia is almost like a membrane which goes from your heel to the base of your toes. So it helps to allow you to stand. It keeps the foot in a proper position, right?
Okay.
And so that it's almost like a little membrane which goes from the heel, just under your heel, and it goes to the tips of your toe. And so that fascia, as I said before, it helps with the stability of the foot. Sometimes that fascia can be very tight and it can have micro tears. And that micro tear can cause a lot of pain, inflammation in the plantar fascia. And that is called plantar fasciitis. The question is, how does that present itself? Patients will have pain with walking, standing, and especially when you wake up in the morning and you make that first step.
That is it.
You feel-
Plantar fasciitis. I knew it.
You
I
have it?
knew it was a thing. I knew it. You step down and it's like,
Yes. Or when you sit for long to
Kind
get
of
up and
pain.
walk around. And
Terrible.
yeah. And so plantar fascia is where that plantar fasciitis is where that fascia is inflamed. It's shortened for some reason. And that causes a lot of pain, you know. How does that happen?
yeah, I was just going to ask you, how you get plantar fasciitis?
Well, it happens several ways. The most common way is when you have improper footwear. One, meaning your shoes not right. You know, so a lot of people will run. The thing when you
I'm
run,
offended by that one. What do you mean my shoes don't right?
so if you run for too long, you're supposed to run 300 miles in your shoes.
Supposed to?
Yeah, 200 to 300 miles or 3 3 years. After that, you have to change the
Just
shoes.
like as a regular person, you have to
Yes.
run 200
Yes.
train.
Yes.
Definitely.
Oh.
Have you
So-
ever had plantar fasciitis?
I have many times.
You have?
Several
Tell us what you
times.
feel.
Definitely, as you said. So I'd wake up in the morning, and the first step I make, there's a lot of pain, and maybe about after 10 steps, the pain starts decreasing
Subside.
until it goes away. And then because I stand for long hours at work, by about midday, I'm having a lot of foot pain. I feel almost this
Really?
burning sensation in the bottom of my foot.
Wow.
Not recently though, because I sorted it out.
Oh,
How you
because
sort that out? Easy because you're a physiotherapist. You just sort yourself out?
Definitely,
God, no?
absolutely,
I never
sort
expect
myself
that one.
out.
I'm never sorry. I never expect that. I thought you were gonna say you went to the Rehabilitation Institute of the Caribbean and they fixed it all.
I do. I fixed it at the rehabilitation.
Right
Institute
true,
of the
girl, right
Caribbean.
true.
Yes.
how did you fix it?
So, well, firstly, there's a shockwave machine that's there.
Shockwave. At least you're afraid of shockwave.
What am I doing on the shockwave something there?
It's just our thing.
God.
Okay,
Yes.
guys, shockwave with no shock. We know electricity. So shockwave is called extracorporeal shockwave lithotripsy for stones. Extracorporeal shockwave therapy. We use sound. So it's a machine where it looks like it has a gun on it, and you hear boop, 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 boop. It sends sound waves into your tissue, and what it does, it helps the tissue to get more.
So sound is really what's healing you.
Definitely.
Yes, sound is healing you.
Man, as a singer, I can appreciate
You can appreciate that. And so we're going to do an episode on shockwave. Why? Because shockwave, it causes neovascularization. So any injury that is chronic, old, it creates an acute injury so the body can heal itself. So it increases blood flow to the area.
That's fascinating.
So that's the shockwave. It's amazing. We can use it for whole heap of things. But we're not going to get into that now because we're talking about plantar fasciitis.
Right.
Right, so, but she was also telling us about her
Experience.
with
Definitely.
the shockwave thingy. Go ahead, tell me what you do. What you do? You shock yourself?
Well, it's not a shock,
Sorry,
actually.
I don't know the terms. I'm sorry.
It's an uncomfortable sensation, but not a
Thank
shock.
you for saying that. Thank you for being so honest on this program.
But
It's
I've
an
had shock.
uncomfortable-
No, but I've had
It's
shockwave.
uncomfortable.
It feels nice though.
Doc, you
After.
know what? No, man. No, I don't believe. It's an uncomfortable shock.
It is not a shock.
It's not a shock.
Sorry,
It's
what
a-
is it?
It feels like it actually feels like somebody is tapping you.
Okay, so it's an uncomfortable tap.
Definitely.
Yes. All right. So the good thing with the shockwave, guys, is don't be afraid. The shockwave is one of those new machines. For example, we've had patients who cannot walk because of the pain in their
Yeah.
foot. You do the
Right.
shockwave and they get up and they walk without pain. That's how quickly it works.
Wow.
We have the shockwave, same thing for the hamstring. You have it in your neck where you have knots in your body. We use a shockwave and the knots are gone.
So the shock thing,
Wave. Yeah.
Yes.
Therapy.
Therapy. Got it. It can be used for any part of the body.
It certainly
Yes.
can. Oh, we certainly can. But, but even before we get to shockwave, the thing with
Sorry.
plantar fasciitis, it can be, the thing is to prevent it. And so what have you been doing to prevent it?
Because you don't have it anymore.
Well, I'm
do
a
you?
dancer. So in dance class, we do a lot of heel raises or releves, as you would say. in
Releve.
dance.
Big
Yes,
word,
and
big
stuff.
word.
Yes.
You know what releves are?
Me? Yeah.
When you go on the ball of your foot.
Yeah, man.
Yes,
There
absolutely.
you go. All of your friends. Relevant.
So what that
Yeah.
does is it strengthens the tiny intrinsic muscles in your foot, the small muscles in your foot.
Okay.
Yeah, so with that and strengthening your toes and your ankles, keeping your calves nice and fit and strong and healthy and loose but not tight.
I
Because
don't know.
tightness also contributes to one of the factors that would lead to plantar fasciitis.
You forgot to help me because I don't know how you strengthen your ankles and your thighs and your thing. I'm sorry. I'm just a call out thing. I'm not really sure. But how do you strengthen them? Like you just stretch
Sure.
it.
So your ankle moves in 4 planes.
It does.
So you can plantar flex, which is like this.
Point your toes
Yeah.
down.
You know, I could be a
Pointing to the
dancer.
front. You could.
Yeah, because I got like the little point. Look at my foot. Talking shoot. I mean, I'm like, nice
Oh,
little
you
point.
have a nice little point.
Thank you all so much for this.
It's true.
Right. Sorry,
And in
go
dance,
ahead.
we would say flex, but in physical therapy term, we say dorsiflex.
Dorsey
Or in
Flex.
Jamaica, you say cock up your foot.
Yes.
Love that. Thank you.
You can in-toe or invert your foot or evert
And
your
so,
foot.
just like as a regular person in life, like me, who don't dance, this is what I would have to do
Yes, definitely.
to just help my people. Just have you You just get up and just do them something here?
Yeah. The thing is,
Yes.
you see the ankle and foot, the rehab for that is we always follow the
Algorithm.
algorithm.
I'm learning things.
And so the algorithm is, of course, we have our first algorithm is prevent. So the first thing we do in the rehab is you want to ensure you have range of motion. And that's what Shade was talking about, stretching.
Love
so
that.
you want to stretch in every plane, the same plane that she mentioned. You want to make sure your Achilles, which is your calf, is well stretched out. Because that's one of the cause. Your Achilles, because she's a dancer, she tell them about your Achilles. It's very strong.
Very strong.
And
It's quite thick.
It's not supposed to be thick. It's supposed to be thin, or it's supposed to be
No,
somewhere
no, no.
in the
It's
middle.
supposed to be thick, but
It's nice and
not.
strong
But that's good.
for her.
Yes.
Thank you all for saying that.
Yes.
Yeah, but now take time with doing it.
Yeah, man.
So your calves should be flexible, not
yes.
tight.
Yes.
Oh,
Yes. But at the same time, stable.
Yes.
Because the thing is, too, we're going to talk about Achilles tendonitis, but you can actually rupture that tendon. It's called tennis leg, although, it's not while you're only playing tennis, but you can get it. But with plantar fascia, as I mentioned before, improper shoes, training on uneven surfaces, overrunning, it can be an overuse injury because she probably got it when you were dancing a lot.
Yes.
yeah. That's
Right.
what they,
Right. There's a lot of, as I said, releves, and even in jumps, you do tend to do that same motion, plantar flexion, or pointing your toes with your foot.
But
So
what
there's a lot of that.
Okay, but what about women who wear high heels and have to sing in those high heels for a very long time, like me?
Yeah, that's a very good point. Because if someone who's always in high heel, it kind of shortens the Achilles and the plantar fascia. And when you go flat, you feel like you're tearing.
Yeah.
You have that?
Yes.
Yes. So you wear a lot of heels.
When I go to my church, I have to wear a lot of heels.
Nice.
And then when I have to take it off, it feels like
You're falling backwards.
I do feel as if I'm falling backwards.
Because the heels are tight. Your heel, the heel cord, and the plantar fascia is
So what do
tight.
I do when I
Yes,
step out of my heels?
You can stretch in dorsiflexion. So which is a flexing dance term. So you're pulling your toes back towards you.
Yeah. Okay.
So what you can do is extend the knee or straighten the knee,
Yes.
hold the top of the toes, and pull it back towards you and hold for 30 seconds.
That's a long time. That's
It
a
is.
painfully long time. And then I let it go.
And then you let it go.
Man, look
and
at
then
that.
you do it two more
Look at
times.
me, Dorsey flexing and all kind of excitement. So when we come back, because we're going to take a break, we're going to go into a little bit more of the plantar fasciitis and risk factors and physiotherapy treatment and all of those nice things. Stay with us. Welcome back to Rehab Now. If you're just joining us, we're talking about the foot, specifically plantar fasciitis. And we have physiotherapist with us, Sade Thaxter, and our very own Dr. Paula Dawson. Sade was just taking us through treatments for plantar fasciitis. Go right ahead, Sade.
Yes. So, as I touched on earlier, there were the intrinsic muscles in the foot. Those are small
Right.
muscles. So, there's a saying called that goes, if you don't use it, you lose it.
Man,
Yeah.
that is so true.
It is, yes. So, if you're not exercising those tiny muscles in your foot, they will atrophy. So, they'll lose mass. They get weak.
It gets smaller.
Yes, and smaller. So, in order to strengthen those, you can do some exercises like curling up a ribbon or a towel under the foot. You can spell the letters of the alphabet
With your feet?
Yes.
That's
In
funny.
capital letters.
Capital letters.
Without moving your knee. So you're only moving your ankles.
Okay.
So you can't move your knee.
Very interesting.
So try the A.
Look at me.
Let me see you do
I'm
it.
look on my foot. Come and have a lotion. So good. So much. Yeah.
You know, say you're done, so.
A.
B. Capital B.
Ba. Capital B.
And
No,
so
it's painful, you know.
as Sade said, when you're putting the ribbon or the towel on the ground, you have to put the towel on the ground. You're seated, and you use your toes, and you pull up the towel, and then you push up back the towel.
Wait, so all of these things that we're doing as children is not just games.
No, not
Because
at
I
all.
see them foolishness there, you know. Thought it was foolishness, but look at that. I'm
Yes.
preventing plantar fasciitis
Yes.
and keeping my intrinsic muscles.
Very good.
Yes.
Thank you so much. I'm really learning.
Yes.
Is there a way? Because you say if we don't use it, we lose it.
Mm-hmm.
How much lose it are we talking about? Will I be able to lose the ability to walk, or no? That's too extreme.
Not necessarily, because you'd still be walking around, so you
Yeah.
still have enough muscle mass to
walk.
do your regular.
Yeah, but then what exactly am I losing then? Because if for some people are just like, well, I mean, if I can walk, I'm good.
So let me tell you. So there's something called windlass, which is the arch of the foot, and so the intrinsic muscle will keep you up. Windlass is something. You ever see those crane on a ship? That's kind of like what windlass is. So the intrinsic muscles keep you up. When the intrinsic muscles get weak, you go down. And you get flat foot. Although some flat-footed people, it runs in their family.
Yeah.
But you can acquire something called pronated feet, where you start getting flat-footed. So my left foot is flat foot, and my right foot not quite flat foot. So I'm starting to pronate on my left, and my right is fine. So I usually have plantar fasciitis on my left side. So pronation is one of the things where you get flat-footedness is one of the causes of plantar fasciitis. Right, and so the intrinsic muscle will allow you to maintain the windlass, or the ability to maintain the arch in your.
So we
foot.
want that arch.
You definitely want, but you don't want
Not too high.
because too much arch is pes cavus. Nothing else but putting to pes planus is flat foot. Pes is foot. Pes is foot.
That's his
nothing.
foot.
Planus is flat, plane, and cavus like a cave. Pes cavus is high arch.
So we know what it is when it's too flat, but when it's too high, what are the problems that we can have? Or we don't have any problems?
Same thing, because the muscles are
Same
now
thing.
overfiring, and you're not in the ideal position. So the body's so amazing. God made it so that you don't have too much of one thing. Not too much curve in your spine, not too little curve in your spine, not too much pronation or supination or arch in the foot is supposed to be ideal. So it's most efficient position for ambulation. All right? And so with the exercise that Sade was talking about, you can strengthen the intrinsic muscles in your feet, but you also want to strengthen the calf.
Yes, definitely. So with the calf now, we want to strengthen and stretch it. So a good way to do both is to stretch it eccentrically. Now, an eccentric contraction is when you contract the muscle while you stretch that
Long and
connected
strong.
joint.
No, man, that painful.
No, not at all.
May I tell you? Muscle contract for me. Okay? So say this again and give me an example. So you're stretching.
While lengthening the area. So take for example my bicep. So the muscle is contracting. I have tiny biceps, but you can.
So when you bend your
The muscle
elbow,
is contracting like this, right?
Yeah.
when you bend your
But-
elbow,
Right, when you bend your elbow. So before I even get to that, the main function of the bicep is to bend the elbow. So this would be a concentric contraction, contracting the muscle while the arm is moving closer. So the muscle itself is shortening. An eccentric contraction is the opposite. So the muscle is contracting, but it's lengthening.
it has to be done against resistance. Yes.
God, I teach people that in singing.
Yes.
How am I getting this in my hand?
Yes.
So
So
while
for-
this is going on, so while this is going on like this, me have it.
No, but you're doing it against resistance. You're doing it
Okay.
against
Right,
a weight.
so let me hold your arm
So
like this.
this is my arm.
So contract your biceps.
So
Pull,
So while
bend
she's
your elbow.
contracting her biceps,
Resist me.
Sade is actually
Resist me.
resisting her, and so
So lower
she's
slowly.
lengthening it.
It's lengthening.
Yes.
That
Yes,
is
there you
painful.
go.
I can't feel my arm.
Alyssa is a baby. So all
No.
Sade was doing, guys, was Alyssa was bending her elbow, and Sade was preventing her from bending it while lengthening it.
Yes.
And so Alyssa now
was
has
so
contraction in the
It was so
muscles.
horrible. I can't feel my arm.
No, so the good thing with the feet is that when you do heel rise, meaning you stand on your toes, you go up. You're shortening the muscle. So that's concentric. So what we usually recommend for eccentric is you stand at the edge of a step
Yes.
and
And lower the heel.
lower the heel down from the step. So you use your body weight as your
Listen, I'm
resistance.
telling you, we do these things as children.
Yes, we
Continue.
do. And so eccentric strengthening exercise strengthens the muscles more because it's more work. more power that you require to do that, and so the muscles get stronger.
But they tell you don't do that because you're going wear out your heel back, or you know what I mean?
I'm not so sure about that, but that is the way you do it.
No, you're a doctor. You're telling me the right thing. I'm just telling you what I heard.
Yes.
As a child, no, that shut out your foot back, or
Yes. And so the eccentric strengthening of the Achilles is important. So you can also eccentrically strengthen the foot because against resistant bands, right? So Sade, I think Sade, you've treated me you've done shockwave on my plantar fascia once.
No, it wasn't your plantar fascia. It was your traps.
Oh, I've got shockwave.
I feel like you enjoy
It works because after I
shockwave
do it,
things.
it works. It works well.
So what about people who are obese and people who stand up really, 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 really long?
You see, that's another good point, right? So long-standing, like Sade used to do when she used to dance and working as a physical therapist, she puts her foot on a lot of pressure. And so people that are overweight, they tend to have a lot of pressure on their weight bearing on their feet as well. And that can cause the muscles in the feet to become fatigued. And so they get tired, and that can also predispose you to getting the arch falling. Because it's, just pounding all day long without strengthening can lead to that as well.
Okay, because I thought the solution was just sit down, don't stand so much.
Don't stand so much. But there's more.
Yeah.
There's more to the therapy.
Yes, definitely. I mean, with the long standing, you can take breaks if you're allowed to do that at work. Not saying you should disobey your boss.
Right. So in addition to that,
there are other things that you can do, like wearing something called a night splint.
What's the night splint? Can that sound injection? It sounds needly.
It's a brace.
It's when I hear splint, I think splinter.
No.
Oh, really?
Yeah, that's what I'm hearing.
That, actually.
Splinter.
Like in the woods and you break your foot and you get 2 pieces of board and make a splint or stick.
Something.
All I'm hearing is splinter. It's all I can see. It's all I can imagine. But go ahead and tell me what it really is. It's a brace.
It's a brace that you wear on your foot to keep it in a neutral position, which is almost like a 90-degree angle between your shin bone and your foot.
Okay. So one of the reasons in the morning when you wake up and you step down for the first time, it tears is that, like when you're lying on your bed and you have the sheet on your feet, your foot actually kind of falls down. It goes down. And so when you're like that all night long, it heals in a shortened position. So then it heals in a shortened position. So when you stand up in the morning, it kind of tears. It literally, you get micro tears. But with the brace that Sade is talking about, it keeps you at 90 degrees at your ankle. It stretches you all night long. So when you wake up, you're already in a good position to stand up so you don't get those micro tears.
That is fascinating. I have a question.
Yes.
And it goes to the algorithm.
Yes.
Because we're at treatment, right?
That's right.
So we're doing these exercises for the plantar fasciitis, but it's not working. What if I go to injection?
Yes.
God.
Yes. But even before we go to injection.
We go to medication.
Wonderful. But there's something that we're leaving out of the treatment.
What's that?
Which is the ball. We can ice the foot. So I usually tell patients that have...
Rehab.
Yeah, man. So if you have golf balls, you put them in the freezer, or you can get a water bottle, a plastic water bottle, and put it in the freezer, and
you roll your foot with it. So you kill 2 birds with 1 stone. You get an ice and a roll at the same time.
So what you do when you're rolling it, you're massaging it, and so you're causing the whole structure underneath your foot bottom, the soles of your feet, to relax
and breaking up scar tissues.
Scar tissue, and at the same time, the ice is one of the best anti-inflammatory.
Yes, I know that for a fact.
Yes, right. And so you also have some other balls that you can use. You have packages that you see on Amazon. Do not buy this unless you talk to a doctor or a physical therapist. You have these little balls. And so I had my plantar fasciitis and I had a little ball, and while I'm doing my work, I'm just rolling. And you might I used to feel like gravelly. Did you feel like a little bumpy?
Not exactly.
When it got to my age.
I used a different ball. I used a vibrating sphere.
Tell us about that vibrating sphere.
It's from the brand Hyper Ice. So I think a lot of persons know Hypervolt as a massage gun.
Yes.
So the ball is called Hypersphere.
Yes.
So it's just a massage. It's almost like a roller but in a sphere. So I just roll my foot on
and it's vibrating.
And it vibrates. It has 3 different speeds.
Nice. And so that vibration, so you have the motion of the roll, but then the vibration also kind of give you like a shockwave tapping.
Here we go with the shockwave again. Did not come off it ever in life. But motion is really lotion.
Right. And then, of course, if you have flat feet, what do? Arch support. We can't forget arch support.
Oh.
So you can actually have off-the-shelf arch support that you can buy at the pharmacy. Then you have custom-made one where you actually stand in a mold, and then we can use some digital reproduction of the shape of your foot, send it overseas, and you get an arch support that matches your foot. And it raises your arch and puts you in a better position. A lot of our athletes use that. So a lot of our athletes will get plantar fasciitis because they're flat-footed and, they're pounding.
Mm-hmm.
And so what we do is create arch supports for them to run in their sneakers or in their spikes.
Okay. So we get to, so we're at medicine and we're at injection. Jeez. Is there a point where we get to surgery? Because, with the algorithm, but I don't know if it works with the plantar fasciitis.
In this instance, you usually don't do surgery on the foot muscle.
Okay.
However, in some instances, especially children with cerebral palsy, if the Achilles tendon is too tight, you can extend the tendon.
Extend it.
You can extend the tendon. You can do something called a Z-plasty or whatever it is that they do. You can actually extend the tendon. So when the tendon, in CP kids where the heel cord is too tight, you can actually extend the tendon, but not in athletes, not in dancers. Because, they're younger, you really want to have more, let the body heal itself. The body's an amazing thing. You should see Sade dance.
Oh.
I'm sure she's amazing.
Yes.
I do okay.
She does well. And so plantar fasciitis is something that you can have it actually even if you don't dance. I had a patient once and he had it because there's something called heel varum where when you stand up, the back of your heel turns in. And so every time you stand up, your heel turning in. He actually had a method of driving where he cuts his foot on the outside of his heel and he goes from gas pedal to brakes. And that actually caused his instability and caused his fascia to be tight. And then he developed plantar fasciitis.
Can it be cured? As in, can it go away and then never come back?
Like Sade.
Yes.
So essentially, what you need to do is ensure that you have good
range of motion.
You want to ensure that you have stability by strengthening the muscles.
Your intrinsic muscles in your foot.
And then stretch out your heel cord.
And calf muscles, yes.
And if you need to wear arch support, wear arch support.
Hear that, dancers and athletes and everybody who can
but
get
don't
plantar
forget
fasciitis.
physical therapy.
And don't forget physical therapy.
It's always nice to have a professional to guide you.
Yes.
Well, thank you so very much, Sade Thaxter and Dr. Dawson. That's all we have time for.
Yes.
On Rehab Now, thank you for listening. Thanks to Power 106, our studio engineers, our show producers, Renee, Stacy, and Jeff. Thank you to our sponsors, the Rehabilitation Institute of the Caribbean, Winchester MRI, Immune Active Denk, and Almighty Studios. We will see you all next week, same time.
Bye.
Same place. Goodbye.
Blessings.
Blessings.